Alrighty, welcome everybody to this edition of the CyberGreen slash Ostrom workshop seminar on cyber public health. And today I have the pleasure of introducing Josiah Dykstra and myself, which is somewhat strange. But Josiah is a longtime expert in cybersecurity, the co-author, as Bill points out, of Cybersecurity Myths and Misconceptions, and a director at Trail of Bits. And I'm Adam Shostack with a background in cybersecurity and application security, currently, amongst other things, lead scientist for CyberGreen. And, rather than having a long introduction, Josiah, do you want to just kick us off, give everyone a little background, and then jump into the meat of what we want to talk about today?
Yeah, let's dive in.
Cool.
Um, it's nice to be here. I've been joining these meetings for a while and really excited to have a dialogue with everybody today about an idea Adam and I have been talking about for a while, months at least, 6 months or more. It's still an evolving idea. We are in the process of writing a paper, but we really need feedback, and that will be our call at the end. We'll circle back to this at the end, which is this a good idea? What's wrong with it? Who needs to be involved in it? And we're really excited to share it with you. So um, without further ado, let's go already to the next slide.
Okay.
There a lot of bad, horrible things happen from COVID. We are not out of the woods. This is something that's going to be with us for a long time. And what I got to thinking about 6 or more months ago, in my usual purview of what can we learn from other people and other things, um, this is kind of a common refrain for me, which is cyber is relatively new, and I think we should be looking to other people in other domains that can help inform us in how to do cyber better. Um, and so it certainly occurred to me and to many others, including Jen Sorensen here and Adam and others, that COVID, biology in general, has a lot to teach us. So I think there are lessons we should be looking for. I'm not trying to just coax them out of nowhere. But Adam introduced me to a book we're going to talk about here in a little bit that basically said, yeah, there are lessons that people in biology learned. And so the two of us are trying to sort of tie those into cyber. That's really where we're going here. Next slide. So COVID is something we've all lived through. We all were disrupted by. Hopefully it isn't something that's going to be life-altering forever, even though there were horrible, horrible consequences. Many people died. Economic impacts were tremendous. We still don't even have a good number for that, which is how much economic impact happened. Economists and others are still trying to figure that out. But needless to say, we all intuitively gut instinct know it was a major event, and I hope that it doesn't happen all the time. There are biologic definitions of pandemics. We'll talk about that in a little bit. And there are pros and cons of analogies. I'm certainly something I wrote in that book about cyber myths, which is we need to be cautious. We need to use them sort of deliberately and carefully. Cyber is not 100% the same thing as biology, very clearly not. But where there are important lessons, I think we should draw those out. So next slide, please. So as I mentioned a second ago, I think we are all sort of familiar with the disruption and impact of things like COVID. And the reason that we're going to talk about the impacts in cyber is that it's meaningful. It's not just something that we can ignore. It's not something that we can just live with. But the rapid spread, the impacts to life and safety and economics and human prosperity do matter here. They mattered in COVID. This was something that biologists had been studying a long time. There was a pandemic plan. It didn't work as well as we wanted to. That's going to be a lesson. But having preparation has always been important. It's been important in instant response, right? Learning to do something in the heat of the moment never goes well. I've written about that. Many people have thought about that. Being prepared, having a plan, practicing said plan, all very important lessons. Next slide. We want to scope out right away an important thing that just is not in our conversation, which is that cyber was the victim in some sense of COVID too. There were phishing emails that appealed to people wanting to have a sort of immediate response. There were cyber threats to the healthcare ecosystem, to people working in that field, to equipment even, new vulnerabilities in terms of technology that got rolled out during COVID, like telehealth, work from home. Those mattered a lot. And I think there's lots of people studying those things, but that isn't the focus of our conversation here. We just wanted to acknowledge them and to set that aside for today. Next. So Adam, let me hand this over to you to sort of give our lead in
Sure.
here.
Yeah, so when we started talking, we had a lot of conversations that we needed to define what we meant. And we've come to this term, this is our current thinking, is, a pandemic is worldwide or a very wide area, affects a large number of people, and there have been cyber events like that. But one of the things that I think is defining about COVID is I think we all hope that this will be a once in our long lifetimes experience, that what happened is unique for is unique. And so just having a worldwide worm on the order of Blaster or Slammer doesn't feel like it's sufficient. And so some of the ideas that we're working with are that it affects every member of a large group. It involves behavior change for those people. Maybe it involves some new manufacturing that has to happen and things have to be moved around the world. Maybe it's assumption violating. I didn't think that that would happen. And so these forms of difference are an attempt to capture.
Adam, you went on mute. There we go.
Yeah, I'm not sure how that happened. Thank you. Um, it might be a worm that actually bricks most of the Windows machines in the world. And when I say brick, I mean it's unrecoverable with normal techniques. The data's gone, the utility of the machines are gone, and pushing new machines out of the factories onto boats into ports um, just means there's lots of issues in getting them replaced, and everyone will be changing their behavior for a while. Another thing that we sort of like about the example of a worm bricking most Windows machines is we expect that there would be a bunch of finger pointing that happens, where Microsoft and PC makers and Intel might all be saying it was their fault in various ways. And we think that creates an interesting extension. So when we get to the question of have we seen this before, there's a whole bunch of things that have been big going back to the Morris worm, things like the OPM breach or the 2003 East Coast blackout. Saudi Aramco. This is not super well known, but a worm took out 30,000 of their machines in a way which turned out was recoverable. But if you think about it, say, I'm going to call Dell and say I'd like 30,000 PCs tomorrow. I don't actually know if they could deliver 30,000 PCs tomorrow or next week. So there have been a fair number of big events but none of them feels like on the axes of people behavior and time, they're as big as the pandemic, as the COVID pandemic has been. So 10x worse, not enough people, behavior change, and some of these might be near misses. And I'm a really big fan of using near misses as a way of priming a learning pump. So, there are some limits to the metaphor as well that we just want to acknowledge up front. One of these is that getting patches to the world is way easier than getting vaccines in arms. We're good at changing something to prevent an exploit. And in contrast to human health, where there's issues with things like long COVID. And so that's a gap between our definitions, and it may be meaningful for the research. Another really important definition is biological viruses are local, and that spread gives us time to react. And one of the interesting things about COVID was its transmissibility during a period of a period without symptoms. And the reason that that was so important is because a lot of the prevention plans involved things like temperature screenings at airports, that if people were sick, we would quarantine them. So there are limits to the metaphor. And as we started thinking about this, I put the Jen Sorensen cartoon in at the beginning because people take different lessons from the pandemic, sometimes shockingly different. And so this book, Lessons from the COVID War, is by the group that would have become it's actually a large set of them are part of the 9/11 Commission, and they were ready to be asked to be the COVID Commission, except they weren't. And so they decided to do the work anyway. And so they published this book, Lessons from the COVID War, that both Josiah and I wrote. And Josiah, am I handing it back to you here? Or am I taking on the first couple of lessons?
Yeah, go ahead and do the first couple. Yeah.
Okay. So we're going to delve into each of these lessons, but just to give a quick overview, the six that as we read the book, we felt carried a deep level of this is meaningful for a cyber lesson from the war. First, the value of trustworthy statistics, and we'll talk about each of these. Second, the value of informal networks and how powerful those turn out to be. The third was about unclear roles and responsibilities. This was a real difficult thing through COVID. It wasn't clear who was supposed to be doing what. Communication was not clear and effective, and we think that's really magnified in the event of a cyber event, a pandemic scale cyber event. And it's also magnified because poor communication erodes trust and confidence. And in cybersecurity, we are excellent at communicating badly. The quality of the plans was a real issue, and we'll talk about that. And all of these issues overlap with other issues in what are called syndemics, where there's an overlap of multiple health impacting events all at once. And so we all remember dashboards like this, and these dashboards were amazingly useful tools, and they really came out of an infrastructure that had been built up over a century of vital statistics, reporting requirements where doctors, laboratories, coroners are required to report certain facts as a condition of their license to these institutions. Right? We all know in some level about the Centers for Disease Control, who publish disease statistics. And those statistics exist because doctors report the information. State departments of public health analyze it, they send it on to the CDC, and the CDC and others disseminate it. And it turns out this stuff is chronically underfunded. There's places where modernization programs have been struggling for decades. One of the COVID pandemic challenges was that there were certain CDC reporting pipelines in 2020 that used faxes because no one was funding getting the data into modern data flows. And transitioning to cybersecurity, we don't even have underfunded infrastructure to gather data. We don't have vital statistics, and some of you have heard me talk about this challenge in the past. But the lack of infrastructure is a lesson that we can take. The lack of data gathering and disseminating infrastructure is important. The second lesson, and this goes all the way back to the Morris worm, the tweezers and microscope paper, which is a classic cybersecurity paper. The authors talk about how important their informal networks were in responding to what was going on. And this was, in fact, the motivating event for the creation of Computer Emergency Response Centers, CERTs. But it's interesting to observe how new crises emerge. Institutions have been doing what they've been doing, they have trouble adapting. Informal networks emerged, and early in the pandemic, there was a huge amount of doctors and biomedical researchers sharing information, frankly, in violation of their rules, not just not in ignoring the official channels, but bypassing them to get information to one another. There were things like makers building face shields and learning how to hack ventilators, and all of these informal networks, frankly, rely on the internet today. And so it's worth thinking, we think, one of the lessons from the COVID war is, how do we have these networks work if the internet is dysfunctional? The lack of clarity in roles and responsibilities is a huge problem, right? Healthcare delivery involves all of these different institutions. And frankly, we've seen how interdependent they are with some of the challenges with United Health over the last few weeks. Governance over healthcare is equally complicated, right? There's some of it is FDA, some of it is HHS. Some of it is private insurers, some of it is state insurance commissioners. And we have the same complexity in cybersecurity. So we think there's a lesson to be taken there. And with that, Josiah, I think I was supposed to hand it back to you. Do I do this slide and one more, or?
Glad to jump in.
Go ahead, take it.
It was very clear to the people looking back in COVID that the communication breakdown made the problem worse. There were mixed messages, there were inconsistent messages, there was changing advice just because we were learning things over time. And looking back, they were really, I think, that was very obvious in hindsight. And while there were communications plans, that really was a confounding factor in the response to COVID. Next slide. So we broke this down into two different areas. The first one is that digital communications today are incredibly vulnerable. And that is a mixture of things like trust, which we'll talk about in a second, but also the sort of infrastructure of how communication would even get out in certain kinds of sort of pandemic scale cyber events. So if the internet is down, if DNS is down, if the information can't get out there, there's not that many backup mechanisms. I was talking to somebody from FEMA just the other day who said, yeah, they have generator powered like loudspeakers, but those aren't going to last very long and they're not going to reach everybody. How would we communicate information in that kind of a system if people don't have a television or battery operated radio? All things to sort of think about in terms of the brittleness of our current communications, which is only going to get more digital going forward. Next slide. The other is that we should expect, if there was a cyber event of a pandemic scale tomorrow, that people would react in a way that they reacted during COVID, which is mistrust and a lack of confidence. So if people didn't believe the science of COVID, we should expect they will react the same way if a company comes out and says, well, this is how this cyber event is happening. People will be skeptical. That is just sort of a nature of the ecosystem that we live in today, that misinformation is prevalent. It's very difficult to separate fact from fiction. And we must think about ways to be ready for that. If there was another pandemic tomorrow, I think we would understand that people aren't just going to magically overnight start believing science in a way that maybe we would like them to. And similarly, we must be prepared for that if a similar cyber event were to happen. Next. So lesson 5. There were pandemic playbooks. They were on the shelf. We know that the Obama administration had one that they handed to the Trump administration when that political changeover happened. And that in hindsight, the COVID crisis group said they weren't good enough, that they weren't actionable. They hadn't been well tested. There weren't enough details in them to make them effective. So even though there had been decades of thinking, they just weren't good enough. They just weren't effective. And so there are lots, I'll talk in a little bit about existing plans on the shelf, playbooks for incident response, for emergency management and things like that. But they probably are not the right kind of thing that exists today that would be effective in again, a large scale behavioral changing pandemic style cyber event. And those things must be agile. There's important key questions. We'll raise a couple of them in a second that tell people who's going to do what, how will it be put into practice, and will it actually make a difference in helping ease the situation. Next slide. So the last thing that we drew out of the book was that these syndemic issues limit response. This is a concept that came up in the 80s or the 90s when people were looking at sort of multiple pandemics that might occur at the same time. And particularly, what does it mean for socio and economic societal issues that mean that these events have a disproportionate effect on certain kinds of populations? People who don't have access to healthcare, people who don't have access to education or any other sort of limiting factor that mean that even if there is a vaccine, it doesn't get to everybody at the same time. Certain groups have better response to it than others, and that if there were, for example, multiple pandemics at the same time, these people would be sort of disproportionately affected. Now, in cyber, this happens all the time, right? We're aware that there are multiple cyber attacks going on at the same time, and we have limited resources to deal with them. But more and more, our systems are interdependent. And so an effect on the power grid might have a disproportionate effect on communications or healthcare. And so the complexity of digital systems today mean that um, we should be thinking about what does it mean in terms of containment if we want to stop the spread, or what does it mean for an ecosystem that doesn't have access to expertise or time or money, whether that's a particular critical infrastructure or a particular demographic of victims, where we need to think through what are these syndemic issues that we haven't really struggled with that much yet. Next slide. There are, of course, additional confounding factors in addition to what the COVID crisis group found with COVID that I think exacerbate the need for some kind of pandemic scale preparations in cyber. As far as we know, there are no plans on the shelf anywhere for this kind of scale of event in cyber. There are other playbooks on the shelf, other plans, other people who have thought about sort of smaller scale, different kinds of events. But as far as we can tell, this does not exist today. So one of our reasons for raising it now is that something needs to be done about it. As Adam mentioned earlier, there are very few sort of insufficient statistics and infrastructure that would allow us to know that an event was happening, that it was emerging, that it was spreading, and that it was sort of the trigger to invoke the kind of plan that we're suggesting. Adam mentioned that roles and responsibilities in the healthcare ecosystem were really unclear in COVID, and there are some movement afoot to try and get that resolved, at least in the United States, in terms of who's in charge of what in health. This is equally complicated in cyber. Sometimes on purpose, sometimes American separation of responsibilities and authorities is done intentionally, and sometimes that leads to complexity, right? If there is a cyber situation, sometimes the victim doesn't know who in the US government should I call about that. Is this an FBI problem, a Homeland Security problem, an Office of the National Cyber Director problem? Where do those roles overlap? Where is that helpful, and where is that going to be really, really challenging in a pandemic scale event in particular? So deconflicting, sort of tangling that would be really, really important for somebody to think through. While we contended that there hasn't been a pandemic scale cyber event, there have been other real world events that I think lend credence to the fact that a pandemic scale event would be even worse. And election security and integrity is one example of that. So the states are responsible for elections in the US. That is their role and responsibility. And it means that if there are cyber attacks on that infrastructure, it starts to bubble up similar kinds of questions that we are sort of posing here. Who's responsible for that? How do they deal with misinformation? How do they know that a cyber attack on the election infrastructure in some other state might affect theirs? Does the multi-state ISAC play a role here? What would it mean to respond if election security sort of took on a real critical sort of downturn? Who would be responsible for that? How would it roll out? We're not saying that that is the one that we should be most worried about. It's just that that has already been raised as a concern, and I think starts to get our brains sort of ticking about what would this look like. Next slide. Let me raise two more things before I sort of hand it back to Adam. We think it is really important to develop some kind of playbook or playbooks at many levels, including the national level, to deal with pandemic scale cyber threats. I was surprised when I started hunting around that despite the fact that there's so many playbooks in cyber and elsewhere, there doesn't seem to be a guide for making them. There's no playbook of playbooks at a meta level. And so people seem to just develop them haphazardly a little bit. There certainly has been a history in cyber of these kinds of actionable step-by-step, what do we do if there's phishing? What do we do if there's an incident? NIST has done this for a long time. CISA has a series of incident response plans on the shelf. But I don't think that a pandemic scale event is just bigger cyber event. I think there are important distinctions here. We can't just scale up the plans that we already have on the shelf. I also think it's more than just a traditional incident. So yes, malware is an example of a cyber incident. A pandemic scale event is an incident, but not just a bigger one. And having the playbook, as I think we all appreciate on this call, isn't good enough. Having it is the first step, and then rehearsing it, making sure that it is effective, that it actually can be used. I was reminded a day or two ago that there have been exercises. So CISA runs something called Cyberstorm. They've been doing this for 8 or 10 years. They're planning now for the one that will happen in 2024. But that is about how the federal government would respond to sort of a traditional incident. Again, doesn't take into account the social economic factors and how we would sort of deal with large scale events. Next slide. There are more questions than I think we can even imagine for how would someone develop this playbook. It strikes me that someone like ONCD or CISA would be the natural person to sort of lead at least the national scale considerations for what would go into a playbook. Here are the kinds of questions that Adam and I came up with for how to incorporate the lessons of things like the COVID response. So how do we empower those informal networks? How do we give them access? How do we allow them to share information if normally their company wouldn't allow that? How do we know that those events are emerging? How do we track them? What data would be put into practice whether or not exists now? And if it doesn't exist, how do we start building the infrastructure to do that? I don't even know all the questions that might be considered. These are ones that we think belong on that list. Next slide. Having thought about things like black swan events, that's probably something that comes to some people's mind, which is, well, these are rare, right? Adam had said that we hope they don't happen very often. I think that would violate the sort of routineness of normal cyber events. But businesses have continuity plans. They plan for unforeseen events. The insurance industry deals with this too. And so the unpredictableness doesn't mean that we shouldn't do it. It means the opposite, that we must do it. And I think that's what the concept of black swan events sort of encourages my thinking. Adam, on the next slide, is there anything else you wanted to say about the rareness here?
So I think really the question that I have here is one that how to say this. So I think it's worth thinking about the question of what happens in a situation like this, even as we hope it never comes to pass, because it seems likely that whatever challenges we face are going to be surprising, but that doesn't mean that the effort of planning, of helping to create some of those informal networks, helping people to say, here's what we could do if television stations can't broadcast because they rely on the internet for production. Maybe there is value here, and so I'm coming to the belief that it's worth doing, that someone should be doing some planning around this, and we sort of need your help because we're not sure that there are a number of questions internal to the idea. And there are a number of questions that are external to the idea. And so where do we go to share this? What objections do you have to the approach? Are there questions that are related that make for a stronger paper? And then sort of, we've done a bit of what we might call near catastrophizing work here. right? There's no point to planning for, and then a meteor strikes the Earth and it falls apart. There, plans don't help us at that juncture. But this is not. This is almost worst case scenario. Who does the who does the worst case scenario? Does this fit into its list in some way? And so in the process of working through our draft, we were in a situation where we find ourselves with a lot of questions, and we'd love your help working through these or other questions that come to mind for you. So with that, um, we've got our contact information here. I'm happy to reshare the slides, but really we just sort of want to throw it open to what do you think? Where should we go? What should we do with what we've been thinking about?
So I see a couple questions in the chat, and Bill, I don't know if you have the ability to come on or not. Maybe start us with your first one.
Yeah, yeah. So I, I was kind of curious about the syndromic. Let's see if it works now. Okay. Yeah, I was kind of curious about this syndromic construct of and kind of what you described as elements of what defined a pandemic. Um, and so I looked at it, I thought, well, all of the things that happened kind of in the early 2000s in sequence that happened, and it seemed to be just bang, 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 bang. Like it was a series of really bad Windows and SQL Server issues that were arising that hit, and it was the cumulative effect of that, as opposed to the individual effect of just code red, for example, that I think caused then a big behavior change, not just at Microsoft, where they stopped shipping a server at great cost to do a security stand down and actually start doing stuff like threat modeling, right? And so they actually began to do behavioral change in the way they did software, but it actually changed the way that customers were asking questions, the way that other companies were thinking about it, the way that patching happened. Like there was no Windows update. It didn't exist. Patches were done by CD-ROM, and Windows Update Service was added actually to XPSP2. And so there was a fundamental shift. If that's like a designing the factory or means of production, we developed a means of production in response to that. And so it feels to me like maybe it's that. And then the next one that felt like is like what happened in the last 2 years, 3 years with supply chain attacks, where suddenly now nobody thought much about, it was cursory checking on third parties. And now everybody is concerned, and even including now the FDA's recent requirements to include an SBOM in order to get a product 510K approved to put a medical device in the market. And so you think about like, there's a shift that seems to have happened. And again, it's a cumulative. And so I'm wondering about, rather than even just looking at something in a big chunk like COVID, is there a way of categorizing smaller cumulative actions that have a cumulative effect at shifting the entire way that we think about a problem space, just like those two examples? So I wanted to throw that out.
I appreciate that. Yeah, I hadn't thought of it in terms of that kind of thinking, but I think it is probably applicable to those similar situations. I don't know what characterizes or quantifies. How will we know that it is happening again, other than in hindsight? But it's interesting.
Yeah, it's thought provoking for sure. And for me, the I'm struggling a little bit with the diffusion in time.
Right.
Right. The world, and you and I both worked at Microsoft, Bill, and I've heard stories from folks like Jason Garms who pushed Windows Update into existence,
Right.
and from other folks about the buses lining up to take engineers to call centers, which are a big change.
Right.
And it was it was temporary, right? They didn't spend a month in the call centers, they spent a few days. And so for me, one of the things I'm trying to do in this is to say, what if it had been a month? What if it had actually stopped production, not only at Microsoft, but simultaneously Apple, Google, Cisco, Mozilla,
Yeah.
more places? What does that do as we up the scale?
Yeah. No, I appreciate that. That's a good way to kind of reframe that because I do think that that was singular in the sense of it being such the dominant way of endpoint computing at the
Hmm.
time, right? So there wasn't alternatives, and so in some respects, part of when we look back at examples, and you that had that slide of examples, um, at a moment in time those had different impact than they might have today, right? Where we have alternative means to maybe work around. But at a moment in time, it felt very impactful because of how much of the market was owned by a singular technology at that time. And so, you know, I don't, maybe it didn't have to affect everybody, but there weren't alternatives, right? So like if you look at what was the Mac OS, it was 10% of the market and Linux was basically nothing. And so there was really no alternative. And so so in some respects, that was kind of for endpoint compute or, personal computing, that was a pandemic. Um, you
Okay.
know, I think it took out a lot of endpoint compute generally across the world, right? So, and I'm going to apologize. I have to drop. Um, I'm going to catch on the recording for the rest of the conversation, but thank you.
Thanks, Bill.
Stuart, you've got something in the comments. Do you want to verbalize as well?
Yeah, sure, happy to. I'm Stu Scott, by the way, from the Cyber Statecraft Initiative. I'm wondering, it strikes me that like the way you kind of described the cyber pandemic model, you notice some differences from that and the actual pandemic model. One of them being that like we have seen pandemics before. And as far as I can tell, you guys are making the like sort of argument that we haven't really seen an equivalent scale and reach cyber pandemic event before. But I'm wondering if there is like a limit to the analogy based on, like a pandemic describes a kind of relatively constrained set of things happening. Some pathogen spreads to a certain number of people. There's not, enough treatment, and it is, some degree of lethality. But in the cyber analogies, I'm hearing that there's like difficulty describing kind of what the content of the consequences might be, and that seems to me to be like a huge limit on what type of planning you can do. Which is not to say that you can only plan around like predictable occurrences or predictably severe things, but that like you can imagine several different very cybery but very diverse scenarios, right? Like you can describe all kinds of different outages and where they trickle, and you can plan around those much more easily than some like vaguer systemic thing. I'm wondering if that like kind of opens up the thinking about it at all. I'm curious if yeah, teasing apart basically the predictability of what happens from the predictability of like when it happens helps that planning in your guys' model.
Do you want to jump in, Josiah?
Yeah, I mean, I don't even know where to start other than
So,
yeah, but biology, I think, has a more constrained scope here, right? Where cyber, like if there's a solar flare, a Carrington event that destroys all the electronics, that's wildly different than a software worm, right? Hardware bricking is wildly different than DNS going down. I think the diversity here makes it harder to get our minds around it, no doubt about it.
yeah, and maybe, I like what you said about there have been other serious epidemics and disease outbreaks. Because I think we can put COVID onto a spectrum of it was way worse than most other things that we've experienced in our lifetimes. and maybe some of the way to draw this out is, as you say, to break out what's the difference between it breaks communications, it breaks processing and endpoints. Maybe those different breakouts result in different plans or different parts of a playbook. Uh, I'm curious where else you might see the impacts being if you can draw your idea out further.
I need a minute to think on that.
I do
It
wonder
strikes
if
me
we
too.
can
No, go ahead. Yeah.
categorize the changes of behavior. I hadn't thought about that before, but like, what does it mean to the victims? Like, do they have to communicate a different way? Can they not? Like, what are those buckets of things? Like, to me as the end victim here. I don't know.
I'm thinking about it as breaking as fundamentally breaking either endpoints or comms infrastructure. Right? The Carrington event taking out all of the satellites would, I think, only degrade most comms for a while. We still have a lot of glass under the ocean. But if we didn't have any Windows computers, but all the Cisco routers were still there, people could swap over to different sorts of things. And I think those two possibly with a rise in either misinformation, disinformation, or might be a third category, that the information landscape becomes so polluted as to make comms difficult. And maybe precursors to this, thinking aloud, are frankly, Google search seems to have gotten a lot worse recently. There seems to be a lot more spam in top results. And also, I noticed yesterday there was an announcement that there's a new election security office, and they're keeping the participants' names secret because of threats of violence and the desire to provide them with personal protection so they can get their jobs done.
Hmm.
So maybe that becomes a third category of impact, which ties into our criteria of a behavior change for a lot of people. So I like it, Stuart. Thank you. Just curious, I want to open up the floor to anything any place people want to take this, but also, what are other places where that that thing magnified might turn it into a pandemic scale where a difference in quantity becomes a difference in quality? Do other folks have examples?
Go ahead, Dan.
Well, Adam, I'll react to what you just said, but I had another thought. For resilience, we often think in terms of redundancy. But of course, redundancy, if the opponent is a sentient being as opposed to a microbe, if the opponent's a sentient being, redundance actually raises risk of cascade failure rather than lowering it. So in a way, I wonder if you can say something, if we if something can be said, let me put that way, if something can be said for what are the characteristics of resilience that may not be obvious, like redundancy being a cause of failure when you have a sentient opponent, whereas it is not a cause of failure if you're worried about, train accidents or stray meteors or, whatever. And it's the resilience thing is what I was going to speak on, but I think perhaps the lens to look at what can be done might be the lens of resilience. For example, diminished operation. What does that mean? What is acceptable diminished operation? That's a hard question, and I don't have an answer, but that's what I was going to bring up.
Um, so I'm just scribbling a note, which I don't have to do because we have a recording, so I can come back and take notes. I I want to channel Peter Neumann for a second and say that redundancy gives you two parts of the system along with their interlocks that can fail. And so I wonder if building in redundancy creates additional points of attack that are relevant. Um, Even without the intelligent adversary. It doesn't for biological systems, but it does when we build complex machinery.
Well, it certainly does when you have a sentient opponent. Of course, we could now go off the deep end and talk about AI as a sentient opponent. Or a soon to be sentient opponent.
Mm-hmm.
I think this is a great question because now I'm thinking about resiliency in the sort of biologic sense, right? Which is redundancy is both helpful and harmful because redundancy in terms of are there other ways to distribute vaccines? Is there other resilience other than vaccines, like masks plus hand washing plus like that kind of, that's not exactly redundancy, but it's resilience against that biological threat. But I think it's much more brittle in the digital ecosystem because that gets, I think, maybe back to the complexity and interdependence. The threat to one is a threat to all. It's a great idea, though.
I also like the what is acceptable diminishment of capacity. Um, it's not a thing that came out of the lessons we took from the book, but if you look, just to analogize, our ability to do meetings on Zoom worked well for adults and had a really bad impact on children and their ability to learn.
Well, that's all certainly worth exploring. I don't know if it's in any way possible to draw conclusions here, but it's certainly worth exploring.
Very much appreciated. Um, Opening the door widely, let me ask for ideas about where to take a paper like this. And by the way, if anyone would like the paper in its early draft form, we are happy to share it with you for comment and feedback. But one of the questions is what venue should it go in?
Especially given its interdisciplinary nature, right? It's not a purely technical problem. It is not a purely policy or like as many of you who are academics have encountered, like everybody's going to say, well, it's not us.
So that is a thing I have really struggled with about selecting venues. And I cannot say that I have always been effective. But I think that the first step is who do you want to reach? So, and what do you want to get? So I'm wondering if you maybe want to start with like a blog post somewhere like Brookings Tech, and then write like something more like a short white paper, like see if CACM or Carl Lantware would let you put it in that column. And but I don't know where you would put the longer piece. I mean, it's almost like a book chapter, and book chapters are where you put conference papers after everybody's finished talking about them. So I don't know if you want to do that.
Yeah, we had a conversation with CACM, and it was one of those like, well, it's not just a computer science thing. So it's like maybe the tailored version where like we present the tech problem to that audience. But if the goal is like go develop a playbook, that probably, to your point, Gene, is a different audience, right? That's kind of a, or if it's purely government, but they might be the ones to sort of spearhead it.
Well, I know the Kennedy School was great at that. I mean, honestly, when I came in September 11th, I was like, they're doing a really good job of blowing up the World Trade Tower this year. That looks so real. And if you do look at the exercises they had done previous years, that was why there was nobody harmed when the debris hit a school, because they had been through the exercise and realized that they didn't know where the schools were in the debris zone, right? And they did an exercise about smallpox. People, like the next generation of like suicide bombers infecting themselves with smallpox and then flying around America and hitting every hub.
Mm.
And that's part of where the pandemic response books that wasn't really necessarily used came from that exercise. So I'm wondering if like what exercise would you do for this? Like maybe take 8 of the things that Russia did to Ukraine in the first week of the war and have them happen all at once in the US.
Yeah, there's plenty of dialogue in the public sphere about like China prepositioning to do things in a future conflict, right? Which might suggest now might be the good time to make sure we have good plans for a confluence of big scale, like societal impact cyber events.
All right. Well, it seems like we are both coming to the end of the hour and getting some great feedback, but also tapering a little bit. So I'm going to say thank you to those of you who stayed. Michael Stewart, I've got your email addresses. We'll share the paper with you shortly. And I do want to mention that we have not yet selected a speaker for next month. So if you've got interesting content, we would love to know about it. As you can see, we get really interesting folks here and we have good conversations. So if you've got early work you want to present, or you've got already presented work that hasn't reached this audience, because as we were just discussing, Sometimes finding the audience can be tricky. Drop me a note, adam@cybergreen.net, and we'll look forward to seeing you all next month.